Hi, I'm Gary Takis. You know, it's no secret that the dental profession is in turmoil right now. Practices all over the country are struggling to succeed in these challenging times. I wanted to be part of the solution. Instead of just complaining about it, I wanted to be part of the solution. So we put together this quick video to provide you and your team members some tips that you can use today in your practice to help you develop a thriving practice. The tip that I'm going to talk about today is very simple, but can have a profound difference in your practice. And the tip is this: use digital photography for patient education. Let me repeat that. Use digital photography for patient education. Most of you will recognize the name Dr. Frank Spear. Frank's a friend of mine and a wonderful educator in our profession. Recently, I had the privilege of spending a couple days with Frank on a retreat, and I asked him this question. I said, Frank, if there was one tip that you could offer dentists today to help them guide their patients to accept more ideal care, what would it be? And he said, very simple, without a moment's hesitation. Frank said, use digital photography for patient education. So let me amplify that. Here's how I'd like you to use digital photography for patient education. Take a series of 6 photos, just 6. And I'm talking about digital photos as opposed to intraoral photos. These are digital photos. Here's the series that we take. First one's the head and shoulders shot, just asks the patient to smile naturally. The second one is a close-up showing the middle of nose, middle of chin, middle of cheeks. Patient's holding the cheek retractors, ask the patient to say E. Third and fourth photos are upper and lower occlusal views using the hourglass-shaped mouth mirror. And the fifth and sixth photos, patient holds the retractor and you take a picture of the buccal corridor. Take a picture of the right buccal corridor and the left buccal corridor. Now, what I want you to do with those photos is, rather than uploading them to a monitor or to a display device in your operatory, I want you to upload those to an iPad. Upload those to an iPad. And the reason why I want you to upload those to an iPad is because when you show the patients those photos on an iPad, it instantly becomes an interactive experience. They can take their finger and they can flick to the next video, or the next photo, or they can zoom in. They can take their fingers and pinch them outward and zoom in. So the act of taking those 6 photos and displaying them for your patients on an iPad will have a dramatic effect with the patient better understanding the condition of their mouth. You've all heard that phrase, a picture is worth 1,000 words. By using digital photography for patient education, you're going to hear 2 comments routinely. We hear these every day in our practice. You're going to hear 2 comments. Number 1, you're going to hear, wow, I've never seen my teeth like this before. Now that's probably expected. However, what I'm about to say you may not expect. The second comment you're going to hear from your patient is some variation of, yuck, what's this, what's that, what's this? And instantly the patient is more connected to what's going on in their mouth than they've ever been in the past. So the tip today, use digital photography for patient education. If you like what you heard on this short video, please leave your name and email address, and we'll provide you instant notification the next time we publish one of these videos. Thanks so much. I look forward to helping you develop a thriving practice.